We have Michaela here. We've been working hard to improve some of the changes in her skin that are resulting from years of acne in her youth, and we've employed a multitude of technologies. And right now, what we're trying to do is we've done some direct excisions of areas where the contour was significantly irregular. So we went ahead and excised those, and she's healing nicely from them. There's a little incision over here, another one over here. They're both kind of shaped like the letter L or the number 7. And now we're reducing the redness of those scars and trying to reduce some of the redness and inflammation of the acne rosacea skin type. Pulse dye laser, we've had it in medicine for decades, is a wonderful tool to utilize for folks with acne issues, acne rosacea issues, and any other sort of inflammatory skin issue. So what we're going to do is we're going to gently recline her. We're excited for her. She just completed her physical fitness trainer certification. So she's ready to launch a new career, leaving the corporate world. I don't blame her.
Amen.
So now we all have eye protection, and we've protected her eyes with shields. And what I do is I use a pulse stack technique with this pulse dye laser. In the old days, the pulse dye laser was used with purpuric settings, meaning the patient would come out of the treatment with purple circles all over their face. This is most commonly used for vascular birthmarks and angiomas, port-wine malformations, in addition to what we're treating today. So I'm going to go ahead and start the treatment. It is a little bit uncomfortable. It also has a dermal cooling device, so it sprays some liquid nitrogen on the skin right before each of the hits. She's a lot tougher than I am. When I have this treatment done for blood vessels that sneak up on me around my nose, I jump with every single pulse. She must have a more powerful mind because she's able to control the impulse to want to jump out of the chair. And typically when we do pulse dye laser treatment, we treat serially, meaning we get best outcomes if we have the opportunity to treat roughly 4 weeks apart. But if it's 4 weeks, 5 weeks, or 6 weeks, we're still getting the benefits. And this is a non-ablative treatment, meaning it's creating no wound. She's able to work out right after this, meet friends for lunch, go back to work. There's no restrictions. And what's happening is this wavelength, which is 595 nanometers, is looking for a target. We call it the target chromophore. And in her case, the target chromophore is heme, which is the pigment in hemoglobin, which is the oxygen-carrying protein in red blood cells. So when this energy finds that heme, it pulls the energy into either the vascular structures that are being made in response to these healing incisions, or the new blood vessels being made in response to chronic inflammation from the acne rosacea. And when that energy gets pulled into these little vascular structures, it causes them to contract down and hopefully go away. And the end result is less redness, less thickness, less inflammation, less sebaceous hyperplasia, less epidermal thickening.